This podcast is for general information only. It is not intended as a substitute for general healthcare services. If you have medical conditions, you need to see your doctor. Use of this information is at the user's own risk. Welcome to FitRx with Dr. Greg Dennis. Join me as we challenge the standard sick model of healthcare. This is your source for everything health, wellness, prevention, fitness, biohacking, and more. Hello, everyone, and welcome to another edition of FitRx. I'm your host, Dr. Greg Dennis. And so today we are going to talk about something called acoustic soundwave therapy. And this is a device that I actually just recently purchased for my clinic and went to training on it. And since I've learned more about it, I'm just really excited about all the possibilities that this has in both male and female sexual wellness, as well as some benefits in musculoskeletal pain, which we are going to talk about. And so my guest today is Chrislyn Chaloupka, and she is a nurse practitioner with over a decade of clinical experience. She is the director of clinical services at Omniwave or Gainswave, which is the device we're going to talk about today. She has spent years applying shockwave therapy in her own practice, using it again for both sexual wellness and musculoskeletal pain. She brings a wealth of knowledge. She actually was the one who trained me on the device when I went to get it trained. So she is going to tell us all about it today, kind of how she got into it, and maybe how this device might benefit you. So, Chrislyn, thanks for coming on the show.
Thank you for having me.
Kind of how you got started, and because shockwave is such a specific thing, and there's even a lot of practitioners aren't familiar with it, and so I'm just curious how you found out about it and how you became kind of so specialized in that area.
It was really by chance, to be honest. I was working in a GI clinic and the doctor I worked with started doing hormone replacement therapy. And I decided I wanted to start getting involved in the regenerative medicine as well. And eventually, as the practice grew, he tossed me all of our Gainswave patients, which I really didn't know too much about at the time, but it was treating sexual wellness, mostly men at that point, and using what we call a radial device, was there's different types of shockwave with how they're produced, and so their benefit and patient outcomes vary as well. So originally I started using this other device for sexual wellness, and it did have its limitations with patient outcomes, discomfort, a few other issues as well from a provider and patient perspective. And over time, I really saw the benefit, though, that these patients were experiencing, in particular, men with performance issues, erectile dysfunction. And I started to do a lot of research about shockwave therapy on my own. And eventually, I had an opportunity to help start up another clinic, get it going in Houston, and reached out to Gainswave, and after much conversation, they said, "Wow, you really know a lot about this. Would you be interested in working a little bit more closely with this?" And that was kind of how I became a trainer through Gainswave at the time before Omniwave existed. And through that process, training hundreds of providers, I learned all about the different types of shockwave devices that were being used and were available. So I feel now it's such a great opportunity because I can compare different devices from a true benefit for the patient and the provider, whether it's about their medical concerns or a business perspective for the provider. And I really have spent, I guess, probably close to 6 or 7 years having that broad range of shockwave experience. And then now within the last, I guess Omniwave has been out for going on, 3 years or so. I explicitly train on the Omniwave device now. And I have to say it's been an absolute game changer for providers and patients with the sexual dysfunction as well as musculoskeletal issues.
Okay. Well, let's take a step back and I guess first talk about just sound wave therapy. I mean, kind of what is it? How does it work? Kind of physiologically, certainly, how does it help sexual wellness and just kind of talk about maybe kind of on a basic physiology level, just what it's doing.
Great. I love that. The science behind Shockwave is really incredible. And whether we're treating sexual wellness or musculoskeletal issues, there's a few things at the basis of what's happening that's incredibly important. In particular, with sexual wellness, our focus becomes promoting angiogenesis, which is an increase in blood flow and circulation. So, when we're talking sexual wellness, we understand that when men in particular have an issue with erectile dysfunction, there's usually a lack of circulation and blood flow to the penis to help either create or maintain an erection. Same thing with females, that blood flow, as it begins to become less prominent, can cause issues with vaginal lubrication, painful intercourse, just very unpleasant side effects and feelings with the vaginal area. With musculoskeletal, our focus is really we're creating a controlled micro trauma to the area that we're treating. By doing that, that stimulates the body on a cellular level to start releasing and sending growth factors and stem cells to the area that we're treating to improve, heal, regenerate that area, whether it's from an acute injury or a chronic condition. So, no matter which condition we're treating, sexual wellness or musculoskeletal, we're actually treating the root cause. So instead of just putting all the band-aids on with medications and, other modalities, this is actually treating the root cause, which is why it's so beneficial for the patient.
Okay. Um, well, you talked about you started off with, some different machines. Talk, if you will, about kind of the evolution of the machines leading up
Yeah.
to now Omniwave, which is the latest, and just maybe kind of the differences in those machines.
Yeah. So your most common device that you're going to find in providers is going to be a radial device, and that radial device is producing a shock wave, which is a sound wave, but it's not actually a true shock wave because it is not fast enough to break that sound barrier. So I find it incredibly interesting as we walk through this process to understand the different types and how they're created. With a radial shockwave device, it's actually using a bullet, and we call that pneumatic compression, and that bullet is racing back and forth. So when you have that happening, the shock wave is actually delivered to the patient very slowly. And with it being delivered very slowly, it's very painful to the patient. So for sexual wellness, I can use this, and I did, and I had good results, but I had limitations. I had to numb my patient up with numbing creams in order to treat them so that they could tolerate it. And I certainly never would use that device over a bony joint like a shoulder. You could use it over soft tissue, but it's still going to be very painful to the patient. And the depth of penetration of that sound wave that's going through is going to be very limited. So it's only going to penetrate a more superficial tissue level rather than a cellular level. And it's not going to have as much energy that's able to be produced. So from there, we move on to what we call electromagnetic devices, and they generate a sound wave with a magnetic coil that is compressed, and then that sound wave is created from the compression of the magnetic coil, and it's delivered. So we have a rise time when the sound wave is delivered with that pneumatic compression. It's very slow. It's kind of like hitting with a hammer. We go into these focus devices, which electromagnetic is, that sound wave is delivered faster, so it becomes a little bit less painful, still going to be uncomfortable for the patient, has better depth of penetration, but again is still going to be limited because it's being delivered slower. So a little bit more energy, but still not quite as fast as what a true shock wave would be. From there, we have a piezo, which is its own classification of a focus device. It actually creates the sound wave from piezo ceramic crystals that are compressed, creates the shock wave, the sound wave, and then it's released. So still not able to get the speed that's needed to be delivered for it to be comfortable to the patient and doesn't have as much of depth of penetration. Then we get into the focused electrohydraulics. Those are the only true shock waves Within that umbrella, there's only a few devices that are available on the market. Omniwave is one of them, and it actually has the fastest rise time. That shockwave, which is a true shockwave, is delivered 20 times faster than the other electro hydraulic devices that are on the market. So it's very exciting that we're able to do that because that is how we're able to produce a more comfortable shockwave to the patient where you're not having to numb them up. I can treat them with sexual wellness. The patient doesn't feel a thing. It's going to have deeper penetration. So it's getting to that cellular level to create that healing response in addition to stimulating that blood flow. So that's a breakdown of all of the different types of devices. They all have their benefit. Absolutely. Some are better than others with certain conditions and indications. I prefer the Omniwave and Gainswave system just because it is more comfortable for the patient and I have better patient outcomes with it, no matter if I'm treating sexual wellness or musculoskeletal.
Okay, great. Yeah, I appreciate that. Uh, well, let's get into I guess, the different populations that we're going to use this for. I got familiar with Gainswave years ago, primarily just from male sexual wellness, because I've been in this space for a while. I'm glad that I waited until the Omniwave came out and to get the latest and the greatest. But I didn't realize you could use it for females and musculoskeletal as well, which we'll talk about. But specifically for males, what I like about it is, as you mentioned, it's kind of regenerative. It's treating the underlying problem, which is usually a vascular issue. I mean, I do a lot of hormone optimization in my clinic, and I think a lot of men are, they think that just optimizing their testosterone is going to fix their ED. But again, it's a lot of times, especially as we age, more of a vascular issue, which this treats. So I guess talk, if you will, specifically about men, maybe who's a candidate, what outcomes they can expect, maybe what the treatment protocols look like.
Love it. So I really look at each patient individually as you do as well, and it's not a blanket treatment protocol for each patient. I like to break it down into evaluating. I give them something we call a shim score, and I evaluate the quality of their erection. Is it mild, dysfunction, moderate, or severe? In addition to that, I look at medications that they take for getting an erection, such as Viagra. How well do they work? How well do they respond to those still? Sometimes it's not that they don't respond to them, but they don't like the side effects. They don't like the congestion, the headache. They just don't like having to take it, lack of spontaneity. So it's not always just that it doesn't work. And then from there, I look at what other health concerns they have going on. How many other issues, high blood pressure, diabetes, how many medications for those conditions are they on? And that is how I develop a protocol for each patient. So the patient that has some mild DD, maybe it's not even ED, but just changes in their performance, whether it is the hardness of their erection or their stamina and ability to totally complete orgasm and climax still within the vagina. That is something I take into consideration with maybe they just don't like the lack of spontaneity with those medications that they take orally. And maybe they're very healthy. That patient, I'm usually looking at once a week for maybe about 6 weeks. And then as we continue on, we get a little bit more aggressive with the degree of their erectile dysfunction. They're a little bit more moderate. Maybe those medications for erections don't work as well as they used to, and they have a few other health conditions going on. Those patients are usually going to need about 12 treatments. And I like to do once a week because this is regenerative medicine. So if you're coming in more than once, when we're talking about trying to increase blood flow, we have to wait for the body to have that cellular turnover and actually do its thing and heal itself. So by doing once a week with these patients, I'm talking to them, I'm making sure that they're doing their penis pumps regularly, that they're taking their testosterone and any other supplements that I find is necessary or ideal for them. That way we're all compliant, right? Because they're spending a lot of money to do this procedure in the office, but there's still stuff they have to do at home, their homework, as I call it,
Mhm.
so that they have the best outcome. So I like to do once a week, and I find that that works really well, works better with most of everybody's schedule as well. When we get into those more severe patients, sometimes they do require more than 12 treatments. And sometimes it's also a matter of what type of maintenance program they end up on as well. But that's kind of the basis what we're looking for as far as the erectile dysfunction and what their protocols would end up being like.
Okay. You mentioned a maintenance protocol for say a middle-aged man who say does a series of 6 treatments and is doing
Mhm.
pretty good. Um, I mean, what kind of maintenance will they need? Do they usually come in once a year, twice a year?
It can vary. Honestly, I prefer if my patients will come in once a month after they've done a
Mhm.
protocol. However, if their erectile dysfunction was really more of just a performance issue, they probably don't need that. But I have a lot of men that like to do that because they continue to see the buildup and the effect of that increase in circulation.
Hmm.
So, more so, patients ask to come in monthly. At the very least, I like them to come in every 3 months, once a quarter, just to help keep things flowing and opened up. So, a lot of it depends on timing, finances, but ideally, clinically, anywhere from once a month to once every 3 months is ideal. Once a year, you could see benefit, but at that point, you'd probably be wanting to be doing more than just one treatment, maybe a series of three or so, just to
Mhm.
get things opened back up. I like to refer to it if you have open heart surgery and you have all of your blood vessels opened back up again, you're not going to go, well, hopefully, you're not going to go out and start eating fast food and junking your diet back up again. You have to keep the blood flow open. So, the same thing with a maintenance program with this. We've created a collateral network of blood vessels and we've opened back up what's there. We have to keep it open, which
Mhm.
also means that your lifestyle habits, what you're eating, not avoiding alcohol, cigarettes, all of those are very important things for them to be doing too, for them to maintain their best outcome.
You've mentioned a couple times about maybe if they're not necessarily having ED issues, but they're just wanting it for performance. So, what
Mhm.
can men expect in that regard? Are we talking? Are they going to have like an increase in sensitivity? What other benefits other than specifically of the ED?
Usually, the first thing they'll notice is that they start having better morning erections than they were having. So,
Okay.
usually, there's some sort of diminished blood flow that they may not necessarily be aware of because they're still able to perform when it's time. So, the first thing that they're usually going to notice, whether they're just a performance issue or they are true ED, is almost always that their quality of their morning erections improves or reoccurs where it might have disappeared. That's going to be the first thing. Stamina is usually going to increase, and yes, increase in sensitivity as well. They're going to notice a lot of that. And again, it all comes down to the blood flow.
I'm sure this is going to be variable based on the patient, but how long does it take for guys to usually see results? I mean, if they're doing 6 treatments or 12 treatments, will they see results after just a few, or what does that look like?
The fewer issues that they're having with their erectile quality, the faster they will see a result. So those men that we're talking about will see that morning erection. It could happen as soon as after their initial treatment. For the average male, I will say it usually is about that third or fourth treatment is when they really start to notice a more consistent change. The
Okay.
worse they are, it could take more. My really, really severe patients could be up to 6 times before they start to notice a change. And that was something I didn't touch on. It's important to understand what outcome we're looking for with our patients because somebody that is older, say in their 70s, and has not had an erection in a long time, maybe they no longer respond to the oral medications to get to get an erection. We have to potentially change what outcome we're looking for. Because would it still be considered a success if I can now get the patient that had stopped responding to the oral medications? They just didn't work. They couldn't get an erection, even if they took a Viagra. And I go and treat them with, say, 12 sessions of Gainswave. Now they actually, when they take a Viagra, they can get an erection. So we have to sometimes alter our train of thought as far as what is a success with our patients.
Mhm.
My younger men that maybe they are a little bit healthier, they don't have as much going on. that would be a different outcome. The treatments, they don't need the Viagra. They can get an erection now. That blood flow is there. But I think it's important to understand when we're looking at that patient, and we may have to alter what we're looking at as far as how do we get the best outcome. Sometimes it is going to just be that we're treating that root cause so that a medication can work. That's
Mhm.
not always what we're intending, but sometimes that is the best case.
Well, let's switch over to, I guess, women. So I was not familiar with using this device for women. It just seems like, again, I knew about Gainswave years ago as just being for men. I don't know, maybe it's always been for women and I just didn't know about it, but kind of talk about that with women, who the candidates are, and maybe what benefits women can get out of this.
So Gainswave had developed Gainswave for her protocols several years ago before the Omniwave came out. And to be honest, I wasn't totally in love with the protocols for her using other devices because they had the potential to cause irritation to the labia in particular. And so I really wasn't a fan when I was training when somebody wanted to start doing that, depending on what device they had. With Omniwave, I now feel incredibly confident treating women because of that speed of that rise time is so much gentler to the patient. It's not destroying the tissue externally. So it makes it a lot easier. What we're going to see with women is that we can improve their vaginal dryness. So a lot of women, especially if they're in between that perimenopausal to postmenopausal state, if we are treating the labia area, it's actually stimulating, again, going back to blood flow, stimulating blood flow to the area, which helps the tissue become healthier. So that's one way that we're treating. Also, with painful intercourse, a lot of women have painful intercourse, but then we have to really determine why. Is it because of vaginal dryness? Is it because of what we call atrophy, where the tissue just kind of becomes less healthy? There's a lot of different reasons that women can have painful intercourse. So we have to do a little bit of research with those women and get down to the bottom of what's going on. That's why I love what you're doing as far as balancing hormones with it because it does make a big difference. Um, so the other reason that women can have painful intercourse also is if they've had episiotomies from delivering children, and if the scar tissue is really tight, where the episiotomy has been done, treating with the Omniwave can actually break up some of that scar tissue so that the insertion of the penis is not as painful as it might have been previously. And the other area that it's really beneficial is when we start to have diminished sensitivity of the clitoris, as well as decreased vaginal orgasms. That's a little bit more complex, but we treat over the clitoral hood and the clitoris, and it actually, again, brings back blood flow to the area, which helps promote healing within the clitoris. So as women age, we do tend to have decreased sensitivity there. Of course, hormones still have to be evaluated as well, that by treating that area and increasing the blood flow can actually bring back the sensitivity to the clitoris for better stimulation. And then when we're treating for sexual wellness for women, a lot of times it has to do with urinary stress incontinence as well. So women in particular that have delivered children, they have issues with coughing, sneezing, jumping. It can help with that by stimulating those muscles to repair themselves. So we see great results with treating those women. And while we're treating in that area for that pelvic floor dysfunction, we're also triggering a response in that G spot. And that's where some women, as they get older and they used to be able to have a vaginal orgasm, begin to no longer be able to achieve that. It can help bring back the sensitivity there as well.
Okay. Uh, are the protocols similar, like 6 treatments to maybe 12 treatments if they're older, more severe?
Absolutely. Usually it's 6 treatments for women. When we start talking more about the urinary issues, 12 treatments is more likely.
Okay. All right. And then lastly is the musculoskeletal pain. And so this is something I believe that's new with the Omniwave that you couldn't do with the other devices. And so I guess talk about that and maybe some of the areas in the body we can treat, which I mean is pretty much most of it.
Almost
But
everywhere.
yeah, but talk about I guess what that looks like, how it helps, and maybe some of the protocols that we use there.
Yeah. So when we're treating for the musculoskeletal pain, it really is unique in the sense that after one treatment, most patients have some sort of relief, whether that is a decrease in pain or an increase in range of motion. So I, in particular, see a lot of women perimenopausal, postmenopausal with frozen shoulder. That's probably my favorite thing to treat. It is so incredible to treat one time and to increase their range of motion just after one treatment. These treatments are a little different than the sexual wellness because they only take about 3 to 5 minutes for an entire treatment. And at the end, you are honestly, I mean, you have some sort of relief. We can treat over almost any bony joint, shoulders, knees, wrists, even arthritic fingers, Achilles, plantar fasciitis. There's really not very many limitations as far as what part of the body we can't treat. Um, and so whether your condition is something we will call it acute, if you were going to the gym, you lifted too heavy, you felt a pop, a pull, a strain, we can treat you very quickly. Twice a week, usually for 3 or 4 weeks to get you started. It generates that healing process. Again, brings the blood flow to the area to heal. And then it's also reducing something called substance P, which is a neuropeptide that tells the brain that there's pain. So by reducing substance P, we're able to get a little bit of that immediate relief. And then on top of that, we are creating that controlled micro trauma that tells the body, hey, I'm injured, come here, focus right here, send all of those growth factors and stem cells to come heal and repair this area. So again, it's not a one and done treatment. It does give some of that pain relief immediately, but you have to keep up with a couple more visits in order to have that regenerative response, which is what you're looking for.
Yeah, I haven't had my machine very long, but I've been playing with it a little bit, and I have a family member who has golfer's elbow, has had it for quite some time, and he had it before on the other side, actually had to have surgery.
Mm.
He's really trying to avoid surgery, and he has had multiple steroid shots over time, and then more recently got PRP shots in it because he's really trying to avoid surgery. He got a little bit of relief with that. And then when I got my machine, I said, well, come up here, let's start doing this. He felt immediate relief after the first one, as you mentioned. I believe we're on the third week now, and he loves it.
Yeah.
He's doing great with it. And so, kind of a little success there. What have you seen? Like I said, you can treat about any body part, but is there some, from a musculoskeletal standpoint, is there one in particular that you've just seen in your experience, a ton of success with?
Yeah, I like I said, shoulders in particular with females, but I will extend that to men with rotator cuff tears as well. Obviously, limitations as far as full thickness, partial
Mhm.
thickness, and what parts of the muscle the rotator cuff is actually torn. Shoulders are my favorite. Knees in particular, whether you have had a meniscus tear or you have osteoarthritis of the knee, that kind of goes back to our original conversation about what is the expected outcome, right? Are we going to completely cure somebody of a complete bone-on-bone osteoarthritic knee? Not, probably not, but can I get them to where their quality of life is significantly improved? Absolutely. The other thing I really love treating, carpal tunnel. It is such an immediate relief for somebody that struggles so much, and that is a repetitive motion process there that's going to continue to re-injure. So treating people with carpal tunnel, whether they type a lot, waitresses that are ending up, carrying their, or waiters and waitresses that are carrying their heavy trays, that really helps them. And trying to think what else are my favorites. I mean, I really, I get so excited. I kind of nerd out a little bit on it, but um, those are the ones that I think I see the most immediate response when I'm treating a patient. Plantar fasciitis, that's another one.
Mhm.
And, one that you don't see such a fast response, but you see a great response is diabetic neuropathy. And that's something
Interesting.
that there's really not a whole lot available to those patients.
Mhm.
And it requires multiple treatments. And it's funny because usually those patients, they'll come to you and they're kind of upset. They're like, well, whatever you're doing to my feet, now my feet hurt. And you have to stop them for a second and say, do you hear what you just said? Your feet hurt. That means you feel them,
Mhm.
you
Yeah.
know? So that's really exciting as well. And then they keep going, and then they start getting their sensitivity back, and the numbness starts to dissipate. So that's
Mhm.
very exciting as well.
Yeah, nice. So are there any testimonials, that you've been doing this for quite a while, have a lot of experience in it? I mean, are there patients, whether in, sexual wellness or musculoskeletal or both, that kind of stand out in your mind that you can just talk about, some outcomes that you saw?
Yeah, well, kind of related to that, I want to say that when we're treating for sexual wellness, a lot of times we forget about the other partner. And so some of my most exciting stories are actually men that come in thinking that they need to be treated for erectile dysfunction, and they do, but nobody took into consideration what their wife was going through.
Mm,
Because if they're of the same age, then the likelihood of the male that's experiencing some erectile dysfunction, his wife is probably experiencing perimenopausal to postmenopausal symptoms as well. And so it's very exciting to help that couple that nobody really was talking to one or the other about
mhm,
what could be done. So when you help save a marriage sometimes because you bring back the intimacy to their relationship, that's incredibly exciting
mhm,
and really rewarding. I will say there is a provider in Florida. I love this story. It's not mine, but he had a patient with osteoarthritis of the knee, bone on bone, in a wheelchair, not walking. And over the course of treatment, the x-rays actually showed visible increase in space between the bones. And patient, forever is indebted to him. I
mhm,
love that story because it's almost seems unreal to have an outcome like that. And, you know, patient wise, frozen shoulder, that's got to be my absolute favorite with those patients that come in. Nobody can help them. There's nothing they can do except wait around. And these are women that have lives, they have families, they have children, they work, they don't have time to be down. And
mhm,
so doing that treatment and getting them back to their baseline so quickly, again, incredibly rewarding because this is a patient that nobody thought anything could, be done for them immediately.
mhm,
Um, and just overall, I mean, there's so many patients I think I've treated like that though, that
mhm,
they're told you either need a joint replacement or you're going to be taking steroid injections continually till the end of time until you get something replaced. And then to be able to offer a treatment that is actually treating the real problem and heals them
mhm.
without surgery, that's non-invasive, and it actually works. It's incredible.
Yeah, yeah, that's great.
Mhm.
Where do you foresee this, kind of shockwave therapy being in the future? It's evolved as we talked about a
Yeah.
little bit, and we're talking about the Omniwave, which is the most recent. But I would think they're just going to keep getting better. I mean, where do you see this going in the future?
I think, we're Omniwave is really at the front line of being able to provide that pain-free delivery of the shockwave. I think that's probably we're at the forefront of some of those changes right now.
Mhm,
Shockwave has actually been around a really long time, for decades, and it's really what we consider lithotripsy for kidney stones. So while you would never
mhm,
use these in-office devices to treat that, the actual science behind it is not new, but how we deliver it is what has continued to change. And you are right. You mentioned earlier, a lot of providers are not even aware of Shockwave or what it is. And I do see that changing within the regenerative medicine space in general, is really more education is so
mhm,
important for people to understand what options are out there for them as a patient, to be able to search for those providers that offer this. And I think that it is going to become something that is more prominent in providers' offices over time. And the technology with how it's delivered, I think it's only going to continue to get better and better. That shockwave's going to get faster and faster at delivery. Um, But it really within the patient realm, as far as being able to understand what's available, I think it's slow right now, but I think that it is coming. Just like PRP. PRP, a couple years ago, so few people really knew what that was. They weren't necessarily looking for it. It was providers educating. And now look at it, people search out providers that do that. And I think Shockwave is going to follow that same suit and really pick up a lot more here in the next few years.
Yeah, yeah, very nice. Well, for those that are interested in finding this, I think probably the best way is to go to gainswave.com
Yep,
and you can find a provider in your area. Certainly, I know there's a lot of people from Oklahoma listening, and you can find me at my clinic, but I am also on the Gainswave provider site. But and then you're down in the Houston area, correct?
I am.
And what's the name of your clinic? I don't think I asked that.
Care surgery clinic.
Care Surgery Clinic. Okay. But yeah, just go to gainswave.com and you can look up, again, providers in your area. So, well, thank you so much for all that information as we wrap up here. And I'm going to kind of spring this on you, but I always ask my guests if they could give us one health tip that could make us healthier today. It can be about this topic or not, it can really be about anything. What would you say to that?
I would say, actually, I would put it back towards nutrition. I would say we need to be eating more one ingredient foods,
Oh,
right?
yeah.
Start buying those one ingredients at the store and make your own food from that. Stop buying all the packaged stuff and you start to feel a lot better.
Yeah. Yeah. Great advice. Appreciate that. So, all right, Miss Chrislyn, really appreciate your time and expertise on this subject. And I appreciate everyone listening. And we will talk to you next time. Thank you for listening to FitRx. I invite you to share this with friends and family. If you would like to contact me, you can visit our website at fitrxwellnessok.com, or you can email me at drgreg@fitrxwellnessok.com.